Today, I'm honored to interview one of the world's leading experts on somatic tinnitus. Annemarie, thanks for joining, and would you please introduce yourself?
Yeah, thank you very much for your invitation for this podcast, Rule. My name is Anne-Marie Vanderwal. I'm an orofacial physiotherapist and a scientist. I did my PhD thesis a couple of years ago at the University of Antwerp on TMD, the temporomandibular disorders that are problems from the jaw muscles or the temporomandibular joint, and tinnitus. And currently, I work at the Academic Center for Dentistry in Amsterdam, where I continue doing research and treat lots of tinnitus patients. I also still work 1 day in a week in a private practice in the Netherlands.
Okay, well, good you're here because you're the specialist who can answer these questions, which I get a lot. And the first question is, what is somatic tinnitus, of course?
Somatic tinnitus is also known as somatosensory tinnitus. It's actually a form of tinnitus that is influenced by the somatic system. Unlike other subtypes of somatic tinnitus is linked to the musculoskeletal system. And often it's the temporomandibular area, so this area, or the cervical spine. And actually, about 25% of the tinnitus patients have this specific form of tinnitus. So it is 1 out of 4.
How do I then know if I'm one of those four people? How do I know if I have somatic tinnitus or not?
Yeah, actually, to diagnose somatic tinnitus, it can still be very difficult, but there are a couple of criteria described, and I will give you some examples. So if you tinnitus change, if you move your neck or your jaw, so if the tinnitus gets on louder, softer, or the pitch changes when you move your neck or your jaw, or you clench your teeth, or you open your mouth, this is a criteria for somatic tinnitus. Or other people have when they give some pressure on tender points of the neck, of the jaw, the tinnitus changes as well. Or another question is, did your tinnitus start or worsen after a physical accident? For example, a whiplash accident. Another question can be, do you have frequently neck or jaw pain or tension in your neck or in your jaw? And if your neck or jaw pain increases, does your tinnitus increases as well? So if it's going up and down together.
Okay.
The last question is if you clench or grind your teeth in the day or in the night. And so a lot of people don't realize that they do that, but yeah, you can do that or have some tension on your jaw muscles the whole time.
Okay. Actually, the first one you mentioned, I have tinnitus myself. People who follow this channel know that. And what they don't know is that I can actually modulate my tinnitus, as you said, by moving my neck or my jaw. And I hear that actually from most people. Is that enough to say, okay, I then have somatic tinnitus?
Now, if you only modulation that triggers your tinnitus, but you have no pain, no tension or pain in the neck or in the jaw, or you don't clench or grind your teeth, you most likely don't have somatic tinnitus.
Okay.
I always say, as a physiotherapist, I should have something to treat.
Yeah.
So if there's no neck or jaw problem, I have nothing to treat. So there must be some of the other symptoms as well.
Okay, clear, thanks. And talking about treatment, so how can somatic tinnitus be treated?
It can be treated by physical therapy or facial therapy, which can be applied by the dentist or the physiotherapist. It depends a little bit on the country. In the Netherlands, we are actually very lucky. We have specialized physiotherapists and dentists for temporomandibular problems. So for jaw pain and jaw tension of the muscles or joint problems of the but this is different in other countries. I always advise to look for someone who can treat orofacial pain. And if this is a dentist, you should often combine this treatment with treatment of a physiotherapist. We can treat the neck problems as well.
Okay, and what does such a treatment look like in practice?
Yeah, the treatment is focusing actually on relieving the muscle tension. So we do a lot of counseling on mouth habits and improving the posture, or give relaxation exercises or stretching exercises for the neck and the jaw muscles. But the biggest problem is that most patients, they don't realize that they have tension in their jaw muscles. For example, one important jaw muscle is here in the temporal area. And some people think they have a headache, but it can actually also be muscle pain. And another problem is often that patients don't know that they have tension in their jaw muscles, and they don't know how to relax the jaw. So you have to practice it with the patients.
Okay. And what kind of effect can I expect if I start my somatic tinnitus treatment? I find an orofacial therapist. Will my tinnitus then be gone?
No, most of the time gone. In most cases, the volume and the annoyance level can be reduced by orofacial therapy. In my study, actually, 60% of the patients had a reduction in their tinnitus complaints. So there was actually a quite high percentage compared to other tinnitus studies. And also, especially, we had a very chronic group of tinnitus patients. But I always say there was also 40% who didn't have a reduction. So that's why it's still very difficult. But yeah, you can try.
Okay, so the first step would be is to have a specialist determine whether you really have somatic tinnitus. If you meet those 5 checks, or most of those 5 checks that we just discussed, and then if you start a treatment, then at least in the research you did, you found that 60% actually has an improvement of their tinnitus when they have somatic tinnitus. Okay, so do you have maybe some recommendations for me if I have somatic tinnitus, in terms of exercises I can maybe do at home?
Yes, I have. Most of the time, I always start with some relaxation exercises for the jaw, because if you clench your jaw, you also have a lot of tension in your neck muscles. So it's both good for the jaw and for the neck. So one very good relaxation exercise for the jaw is to just breathe in and to breathe out through the mouth, like this. And try to relax your jaw as much as possible when you breathe out. Because I always say a relaxed position for your jaw is look a little bit silly.
Okay.
Then a second relaxation exercise for the jaw is to put some air in the mouth and to move it around, like this. You have to be careful that you don't move the jaw. Some people are going to move the jaw, but and then you have already again tension in your jaw muscles, but just move the air in the mouth.
Yeah.
And the third relaxation exercise is, I always call it the fish exercise. It's like this. And I always give those 3 sizes for relaxation, and some people like the first, some people like the second, and some people like the third. So choose what you like, but they're all good to relax for relaxation of your jaw.
Okay, thank you. And what should I do if I want to read more about somatic tinnitus?
First, I recommend that you're going to check for the couple of days now if you have tension or pain in your neck or in your jaw. So, and if you think you might have a somatic tinnitus, I would look for an orofacial pain specialist in the area.
Okay, and do you have any recommendations how to find these specialists?
Yeah, in lots of countries, you have trained professionals for orofacial pain. In the US, you can find them on the website of the American Academy of Orofacial Pain. In the UK, it's the website of the ACPTMD. And down under, you have the Australian and New Zealand Academy of Orofacial Pain. If you live in another country, just check for orofacial pain specialist, and I hope you can find a specialist in your area.
Okay, and what about in the Netherlands?
Oh, in the Netherlands, you have a website at www.defysiotherapeut.com. And you can then choose for orofacial physiotherapist, and you can see where there is an orofacial physiotherapist in your area.
Okay, thanks. I'll put the links below the video to the sites you just recommended so people can easily find them. Do you have any concluding remarks about somatic tinnitus?
No, but I actually hope this helps for patients and they get more insights and maybe they have somatic tinnitus and I hope they can find a specialist. And if they have any questions, I think they can contact your channel.
Yeah, good point. The easiest is that if you have a question, you leave a comment below the video and I'll see if I can answer it. But I'll most likely ask you to answer it. So thanks for that option.
That's perfect.
Yeah.
Yeah.
Okay. Well, thank you very much for the interview and yeah, see you later.
Okay. You're welcome.
Yeah.
Bye-bye.
Bye.